Good afternoon, everyone. Thank you for having me and thank you for being here today. So for my presentation, I will discuss about the various patient assistance programs available and ways to help you obtain your treatment for Wilson disease more successfully. Oh. Why am I going backward? So I have nothing to disclose in relation to this presentation. And here are my objectives. When thinking about the goals for the Wilson disease treatment, one of the things that we want to achieve is to maintain the copper level within acceptable ranges, and this is through a combination of dietary restriction and medication therapy. The other goals is to minimize any symptom and prevent any long-term organ damage. When thinking about the challenges of Wilson disease treatment for patients who are taking the medications, specifically with copper chelators, they might experience potential neurological worsening, generally in the early phase of their treatment. All patients are required to adhere to lifelong therapy and dietary restriction, which oftentimes could be difficult to maintain throughout their life. Patient might encounter medication side effects, complex dosing regimens, and potential drug interactions. Some patients might also encounter financial constraints due to the need for lifelong therapy. And lastly, oral chelators like penicillamine or trientine do require an adequate renal function to be effective. So oftentimes for patients who have impaired kidney function, they might not respond to therapy as effectively and might have limited treatment options. So even though we don't have a medication to cure Wilson disease, we do have medication that can manage the disease effectively. So as Dr. A discussed in an earlier presentations, we have penicillamine, trientine, which are your copper chelators that helps to induce copper elimination in the urine and also moderately can also block copper absorption in the gut. And then we also have zinc acetate, which block copper absorption in the gut. So now we'll be talking about each individual medication and discuss about the patient assistance programs are available to help you access the treatment if needed. So the first medication is penicillamine. Penicillamine is available as both brand and generic versions of the medication, so the brand Coupamin and generic penicillamine. The medication is dosed 2 to 3 times daily and is taken on an empty stomach. Penicillamine can lead to vitamin B6 deficiency, so patients are taking penicillamine are advised to also take vitamin B6 supplement. There is potential for severe or paradoxical worsening of their neurological symptom, especially in the early phase of the treatments. Therefore, it's very crucial that the provider start low and go slow in terms of the dosing and titration. There's also potential risk for early sensitive reactions that might, in some cases, might need to discontinue therapy. And then lastly, the medication is stored at room temperature in a sealed container, and you can access this medication at many pharmacies. Most of the medications for Wilson disease treatments are considered a specialty medication, which means that oftentimes the provider might need to submit a prior authorization to request for coverage from your insurance. So for patients that experience financial issues, either due to having high copayment, denied coverage, or uninsured, they can consider some of the following patient assistance programs if applicable. So we have the Bouch Health Assistant Programs, which is available for patients who are uninsured or denied coverage, and the provider has already exhausted all the appeal options. There is an income requirement for this program, so generally it's less than or equal to 300% of the federal poverty level. And then if approved, the patient can access the medication at no cost. We also have the WDA Access Program, which is a manufacturer copay saving programs that are available for commercially insured patients. So these patients have already been approved for the medication through their insurance, but continue to experience high copayment. So this program can help lower the copay down to as low as $25 per fill. Unfortunately, in California, we have a California Assembly Bill, AB 265, which was signed into law in 2017 that prohibits the use of the manufacturer copay card for a brand product when there is a generic version available. So this option might not be as useful for patients who live in California or another state with similar law, but there are some exceptions to the law. So for example, if the patient has already completed the required step therapy, or if the patient has obtained a prior authorization approval for the brand products, or if there is no other treatment options available or lower cost option, then this program remains a viable option for the patients. And lastly, at UC Davis, we do provide programs called MACWAP for Medicare insured patients whose medication has already been approved by their Medicare plan, but they continue to experience high copayment. So similarly, these programs also do have an income requirement of less than or equal to 400% of the federal poverty level. This program requires the medication to be prescribed by a UC Davis provider and must be filled at a UC Davis specialty pharmacy. And then once approved, the patient can receive the medications as low as $0 per fill. Moving on to the next medication, Trientine. So there are two versions of Trientine that are available for the treatment of Wilson disease. So Trientine hydrochloride or dihydrochloride, which have the brand Cyprine. And then we also have the Trientine tetrahydrochloride with the brand Cuvir. So with Trientine hydrochloride, so that one is available in both brand and generic versions. It's typically dosed twice to 3 times a day, and also is taking on an empty stomach. So need to have that 1 hour before or 2 hours after meal separation. With Trientine, they can actually bind to iron and create a complex that can be toxic. So co-administration between Trientine and iron should be avoided. So there should be some separation between those. And again, patient is recommended to take Trientine with plenty of water. The medication is generally should be swallowed whole. The capsule should not be chewed or open. For this one, generally it should be refrigerated, but although there are some manufacturers that might have some recommendation where the medication can be stored at room temperature, but generally it should be refrigerated. And then it can also be accessed through many pharmacies as well. And then we have the Trientine tetrahydrochloride, which is your Cuvir. So this one is dosed. It's only available as the brand Cuvir. And it's dosed twice daily. And it should also be taken on an empty stomach, should be taken with plenty of water. The tablet should be swallowed whole without chewing, crushing, or dissolving. All those Cuvir tablet is actually scored, so if you need to divide it into half, you could have that possibility to make the pill a little bit smaller. And then for this medication is stored at room temperature in a blister pack, so it can be convenient for patients if they need to travel or take the medication with them. For this medication, you can only fill this medication at one specialty pharmacy. It's called Panther RX Rare Specialty Pharmacy. So off note, the content of the Trientine base between these products are not the same, and they are not substitutable between milligram to milligram per basis. So in regard to the patient assistance programs available for Trientine hydrochloride or the brand Cyprine, they are very similar to the programs available for penicillamine, since both of these medications are available in both brand and generic versions, and they also have the similar manufacturer for the brand products. In regarding to the patient assistance programs for Trientine tetrahydrochloride or Cuvir, the manufacturer Orphelon do offer a quick start programs, which is a short-term programs that allow free access to medication while the insurance is being determined. So this program requires the provider attestation, the patient approval, and a 5-day waiting period, and you should be able to access the medication at no cost. The manufacturer also offer a co-pay assistance programs. Again, this is for commercially insured patients whose medication has already been approved by their insurance, but they continue to experience high co-payment. So with this programs, it can lower their co-pay down to as low as $0. There is no income requirement for this program, but there is a maximum awarded amount, and that amount is restarted every year. And then lastly, they do also offer a long-term patient assistance programs. It's typically reserved for patients who are uninsured or denying coverage. There is an income requirement for this program. However, that exact amount is not publicized, but generally, if you encounter access issue, it's worth trying to submit for this long-term program. And then if approved, the patients should be able to access the medication at no cost. And moving on to the last treatment options, zinc. So zinc acetate is the only zinc salt that is currently FDA approved for treatment of Wilson disease. It is available as a brand Galzin only. It is dosed 3 times daily. And again, is taken on an empty stomach 1 hour before or 2 to 3 hours after a meal. Irritation of the stomach lining is most commonly reported with the morning dose. So if patients experience any side effects or symptom, pediatric patient can consider taking their morning medication about 1 hour after their breakfast, and then the adult patient can take their morning dose between breakfast and lunch. And then with early paradoxical neurological worsening is very uncommon with zinc, and zinc can be used effectively in patients with impaired kidney function. The medication, again, should be swallowed whole without opening or crushing or manipulating the capsules, and is stored at room temperature in a CO light-resistant container. And then this medication, again, similarly to Cure, this is only can be filled at one Pacific specialty pharmacy, so a Noble. In regarding to the patient assistance programs for Galzin, so the manufacturer again also do offer, Eton also offer a quick start programs for patients. So this program will allow patient to access the medication at no cost for a limited time while the insurance is being determined. For this one is usually will be offered to the patient if there is no, the medication haven't been obtained within 3 business days. There is no income requirement for this program. And then similarly, they also have a copay assistance program, which is available for commercially insured patients whose medication, again, is approved by their insurance, but they have high copay. And again, if approved, they can lower the copay down to as low as $0. And then they also have a long-term patient assistance programs for uninsured or patient with high copayment. There is also an income requirement, but that information is not publicized. All Medicare patients will qualify for this long-term program. The reason is because Medicare do not cover zinc as they recognize zinc as a supplement. So if you have a Medicare plan, you likely would be able to qualify for this program if you meet the income requirements set by the manufacturer. So even with the available patient assistance programs, some patients might still struggle to access zinc. So they might wonder if they can consider other non-prescription zinc salts. So unfortunately, over-the-counter zinc products are not FDA approved for the treatment of Wilson disease, and data for use in this population remain limited. Right now, currently, we only have zinc acetate as an approved product. So generally, your doctor likely would only advise you to consider using other zinc salts in special circumstances if and when you're unable to access zinc acetate, and or if you have significant intolerance to that. There is a study that conducted that compares zinc acetate, zinc gluconate, and alternative zinc. So in this studies, they saw that more than 50% of the patients actually use non-prescription zinc. The alternative zincs included in the study are zinc sulfate and zinc picolinate. And as an outcome, they saw that the target urine copper level was achieved in 81% of patients on zinc acetate, 73% on zinc gluconate, and 50% in zinc on alternative zinc. So it's just something for you to reference if you ever get into a situation where you have to consider alternative options. And then next, I would like to touch base briefly mainly on the specialized care. So since Wilson disease is a rare condition that requires lifelong therapy, it is advisable that patients consider consulting provider at a center of excellence for Wilson disease at least once or long-term if possible. And the reason is at these centers, the provider have robust knowledge or experience to care for patients with Wilson disease. They also have a multidisciplinary team that can help streamline care and also provide comprehensive care, which further optimize their care and potentially allow timely access to essential treatments. I'll go ahead and skip the next two slides on specialty pharmacies, and I'm running out of time, but I'll be happy to answer any question you have later. And before we end, I just wanted to direct your attention to the Wilson Disease Association website, because some of the information that we discussed today in regarding to patient assistance programs might change in the near future. So this would be a really good resource for patient and caregiver to reference. The website is constantly updated, so their information on there would be accurate. And here are my references, and thank you so much for your attention.